Welcome, everyone. Nice to see you all. We'll just wait one more minute, let a couple more people land, see if they can join us for the Meet the Candidate today with Meghan Moyer. Mhm. Alrighty. Well, people can join us as they come. Let's get started. Welcome, everyone. Thank you for coming together to talk about what's coming up in the current election, to meet Meghan Moyer, who is running for Multnomah County Commissioner position in District 1. Thank you so much for being here today, Meghan. We have about an hour today, and the way it will work is Meghan will have some time to share some of what she's thinking, and then we'll have some time at the end, about half of the time, to have some question and answer. My name is Amy Riley. I'll be the moderator today. I use she, they pronouns. I'm faculty at Portland State and teach around housing and food justice. And I'm a volunteer for the community advocacy group with Impact Northwest. Today, this cafe, Meet the Candidate Cafe, is hosted by a number of Portland area nonprofits doing really great work in our community and a part of the homelessness and housing response. A special thank you to Portland Tenants United, Blanchet House, SEI, the Northwest Pilot Project, Path Home Transition Projects, Our Just Future, Impact Northwest, the William Temple House, and the Welcome Home Coalition. We're so grateful for these opportunities we've had and this opportunity today to meet our candidates. And we're hoping to engage as many stakeholders to be able to learn about each candidate, their background, and their vision for our county. As the hosts and my participation as a moderator, as 501c3 nonprofits, it's really important to note that we're not endorsing any candidates. We just really all believe that civic engagement and advocating for the communities that we work with and work in is really important. With that, we'll set the scene with some ground rules before we get started. Our goals today are that all participants are treated with respect and treat others with respect. Bias, racist, homophobic, any other forms of hate are not tolerated. The microphones are off, and during Q&A, we'll unmute you so feel free to speak up. You don't have to just put questions in the chat, but you're welcome to do so. Or you can raise your virtual hand or even your live hand if you like. And the event will be recorded today so that we can post it and more people can hear this great information. So with that, I'd like to welcome Meghan Moyer. Thank you so much for being here. You'll have about 20 minutes and I'll let you know when we're close to the end.
Okay, great. Thank you for having me. I appreciate the invitation. To give you a little bit about my background, I'm currently the Public Policy Director at Disability Rights Oregon. I've been there for 3.5 years. And I've done a variety of different public policy roles throughout my career. And I've also spent a little bit of time in construction, including building low-income housing as a general contractor. So I have an interesting split background, but the reason I'm running for Multnomah County Commissioner is my concern about the fact that we continue to be in a homeless crisis and yet are not making significant progress toward building a functional behavioral health system. And so, I talk a lot about where I feel that the conversation hasn't gone and needs to go. And one of those things is I feel like we have a lot of decision makers and vocal community members who have varying degrees of compassion. Some are very compassionate, but have a very minimal understanding of how these systems are funded, what opportunities are out there, where the gaps are, what those gaps actually mean to the reality of what's happening on the ground. And so the approach that I have seen that I have some critiques of are, falling in love with one-off ideas instead of understanding that we fundamentally need to build a functional system that will then fund and support all the levels of care and all the types of services that are needed. And I'm a little less in love with individual one-off projects, and I talk about this because ideas by themselves tend to be of limited value if they don't fill a hole in a system and it has whatever the needed follow-up services or the needed front door into service. And so a lot of my conversations tend to be a little critical of the plans. And so the reason I'm systems focused is I have spent a lot of my policy career specifically in human services and more specifically in Medicaid. Both our OHP program, our 1115 waiver, but also very involved in Oregon adopting and designing our 1915K long-term care state plan, which has to do with people who are going to remain in need of service, and the service is not so focused on delivering medical care, but it's the long-term services and supports that allow people to remain as independently as possible in community with those supports. So we're not talking about doctor's visits or medication or that type of stuff. Long-term care is really, you have an elderly relative and they're in an assisted living facility and they're low income, that's Medicaid. And having a background of both our OHP program, I was on Governor Kitzhaber's healthcare transition team, the beginning of his third term. When he came back to office, I was involved in designing CCOs and what they were and were not supposed to do. I'm disappointed in how behavioral health ended up functioning through that. I think there was a very different vision than what actually ended up happening. I think there are a lot of reasons to go into that, but we have a lot of untapped potential in Medicaid to fund a functional system. And so, I'm running to talk about how we need to look at behavioral health like we look at many other serious chronic health conditions and have a more mature understanding of what a system looks like. So, I talk a lot about people who need hospitalization for severe mental illness or substance abuse. And a lot of people don't mean, I think you guys probably do know this more than a lot of people. There is a lot of dual diagnosis. There's a lot of in between where it's hard to say where, this person fits into this tiny box and therefore is going to go on this trajectory. There's a lot of people who are experiencing a lot of co-occurring conditions that are contributing to why they are remaining houseless. And we continue to have a system that doesn't acknowledge and is totally unprepared to deal with that. And I also think in general, the acuity of our houseless population who have spent a significant time living on the streets is also a level of acuity that our system has not adjusted to. So I'm running to try to build all of the in-between. There's a whole lot that we need that's between Portland Street Response, and I'm a big non-police crisis intervention person, to civil commitment or aid and assist. That there's this huge range of services that largely either do not exist or are extremely difficult to access for somebody. And I keep trying to tell people, you would never treat heart disease this way. Yes, you need an emergency room to deal with an active heart attack. You need emergency hospitalization for somebody experiencing a psychosis that endangers themselves or others. But to discharge somebody after you stop the heart attack right back onto the street with a few days of medication and absolutely no services, they will be back over and over and over again. And each time they will be more and more severe, and their baseline health will deteriorate. And that is what we do with mental illness. That is reality. That is what we do. It is extremely expensive. Medicaid will not pay for that. And it doesn't serve people well. So, when I talk about, I think we can build a behavioral health system that actually doesn't cost more money. It's because we are spending so much money on what Medicaid won't fund and so very, very little on what Medicaid would fund. And so, that's a very wonky reason to run for Multnomah County Commissioner, but it is my motivation. And I am hoping that people are not giving up on providing these essential services. I know they work. I believe in services. It's hard to tell people, please don't give up. All the things you think we paid for are not actually there yet. And that's a tough pill to swallow, because a lot of people feel like I paid those taxes. What do you mean? And they're not here yet. And I get that frustration. And I do think one of the reasons that it's not there yet is we don't have anyone at an elected level who actually understands the system and where it's broken and how these things work. And now is the time that we need that. It's not time to just elect good people who are caring. There are a lot of great people. I'm not disparaging anybody running. I appreciate when people step up, but I don't think we're going to fix this issue until we get some people in leadership roles who can have much, much deeper conversations about why are we not extending our long-term care system to people with mental illness? What would that look like to do that? What does real discharge planning look like if you had eligibility? How could we fund housing and housing with supports on the long-term care waiver so we don't have this funding cliff? So it's not a money loser, but it's self-sustaining. I have a lot of ideas around that, but fundamentally who I am and my expertise is I have spent my career figuring out how to fund the services that work. I'm not a direct service provider. I've never been a direct service provider. I don't think I know how to do that, but I do know how to build systems that are sustainable. I do understand issues like an adequate rate structure, what I mean, I am not sure all of your different organizational funding streams. I know some of you more than others, but I get those complex issues of how does an assessment tool match up with a rate structure and staffing and licensing, and how do we make sure that people are not being inappropriately discharged to a lower level of care they're not ready for. One of the things people don't know, when you do get residential services in Oregon, which is very rare, there is almost always a desire to be looking to discharge you to the next lower. And that is not actually everyone's path. And it can hurt people who have found the right care and are doing the best they've ever done to not be able to say, is this the right level, and not be pushing to discharge. I've worked with clients who have ended up rehospitalized due to a system that continually pushes people out of a setting that might actually be the right one. So how could we use a different model of care to keep people successful in community and avoid homelessness and rehospitalization? So that is my my vision and my reason for running.
Great. Thank you so much, Megan, for being here. Thank you for sharing all of that. Thank you for your transparency. So why don't we open it up for some questions and answers? If you're just joining us and you want to add an organizational affiliation to your name and pronouns, that would be great. And let me just say that like questions and answers can go both ways. If Megan, if you want to ask folks, like providers here, questions, that's great. And please like speak up if you're here as a listener and participant. You can put a question in the chat or raise your hand. Ada and Sophia will help us with unmuting. So who'd like to be brave and go first? Well, people are thinking. Oh, there we go. Andy, go ahead.
Happy to break the ice. Hey, everybody. I'm Andy Nelson. If you don't know me, Executive Director at Impact Northwest. It's good to see you all come out. Thank you. Megan, great to meet you. Thanks for being here. Appreciate your obvious passion and smarts around the issues. Yeah, just a question to sort of get things rolling. One of my observations is that there's sort of a significant disconnect between the elected officials on the Multnomah County Commission and the folks that actually run the different bureaus and departments. The joint office is a good example. It's a mystery to all of us. Now, we do not have a contract with the joint office. We have many with the County Department of Human Services, and even then, I'll get to a question, I promise. But the joint office is a good example. We're up to 123 folks working there. There's a crap load of money coming in, but nobody can really figure out how the mechanisms and the machine works. I think it's been frustrating for the chair and we know that, and for some of the elected officials. I'm just curious, I'm sure you've observed this as well. As an elected, how do you break through that? You don't want to get in there every day and manage the people, but my goodness, I think we all agree that things need to operate really differently, more transparently. And just curious on your thoughts around that topic.
Yeah, I have mixed feelings about the joint office, because I think theoretically it would be ideal. I think the idea that you're going to bring Portland and the county together, and there would be a very clear, delineated, shared vision of where we're going, what was necessary from the city to make that possible, what's necessary from the county to make that possible, who has ownership over what, how we're going to measure that, and how services need to be coordinated and seamlessly go together. That is not how it operates in reality. And in fact, I think it's become a place of, at times, finger pointing, at other times, lack of clear responsibility from, which entity really holds responsibility. And then frankly, oversight is a huge issue. And so, what should the future be? It really depends on, can the city and the county actually devise and agree upon and get down to very difficult questions in an intergovernmental agreement that outlines exactly who does what everyone's committing to, what the accountability will be for it, how, who has authority, who doesn't. Because there are things that, I find as somebody who, I do have the pleasure of being an advocate and not having to provide services, but I am deeply engaged in policy conversations. There are things that are nonsensical to me. I don't know how any provider works on a 6 or 12-month contract. That's ludicrous. I mean, I wouldn't apply. And I have said that. I also feel like, what are you measuring? Keep it consistent. Keep it something that can be measured across similar issues. What, and what is your benchmark? And, I think for me, there is some nuance that I think gets lost with the media around some of a newer service, something that's a little bit being tested. And I'm not against funding those things. I don't think everything has to be a highly researched and verified approach, because I think we do need to do some things that frankly there isn't a great history anywhere of doing. Like, I'm very concerned we have a lack of dual diagnosis substance use treatment. Like, that's totally unacceptable that it does not exist. There will be a level of risk and a reality with outcomes of that population that should not be held to an exactly same standard of, say, people who are accessing substance use who don't experience mental illness. So I don't think it's universal. I don't think you set benchmarks that's like everyone will meet XYZ, but I do think there is some need, and some of it's political. There is a need to be able to communicate better with the public about what it is they invested in, what they're getting for it, what to expect in 6 months, 9 months, 12 months, 18 months. That to me has been an absolute failure from the part of the joint office for many reasons, and I don't know all of them, but I do not want people to give up in supporting services. And I do not think you build a system that did not exist overnight. And so in order to communicate that with people, one, you got to get very real about where we're starting from. I talk to people and I think they think we're, medically assisted detox center away from being okay. If you only, and I've said this, I said, like, do you support that? I'm like, well, one, do I support what? Which version, what model? Yes, I do. I think we need more medically assisted detox. Of course I do. But if you did that alone and you have no treatment, you will kill people. So I don't really support that, and when people are like, well, it's a 24-hour center. I was like, what does that mean? And it's a crisis de-escalation center. I'm like, and a detox? Because that, like, I find it very hard to have conversations when people don't get, we are not just missing a piece. We are missing a system. And so I wish that we had the leadership at the joint office. And I think it requires elected officials to get real in the weeds. And I don't actually think either the city or the county has had the staff who could do that. I just don't. I'm not trying to be unkind, but also I think the joint office needs to, and I don't love silos, but I do think we cannot have one approach. We need to start breaking up specific communities and addressing strategy, going deeper into strategy for specific communities. I'm honest. Have I built low-income housing? I have. I know how to build low-income housing. I am not an expert at financing publicly backed affordable housing. That's not my area of expertise. Do we need it? Absolutely. That's one group. My area of policy expertise is people who experience disability and addiction, who have real barriers to ending their homelessness. That is a subgroup. It is not the majority of people, but it is a very, very difficult to serve population who needs a specific approach. And to be honest, approaches, even within that community, that is not a monolith. And so, I get very critical when people want to simplify ending homelessness as if these communities need the same solution. There's a candidate for mayor. I don't know him personally. I've met him several times. He's an extremely nice guy. He's a business owner. But he has a shelter plan that I am like, that is ludicrous. Your shelter plan, I love that you want to fix this and I'm all for it. But you can't just open up 10 shelters and push everybody into that and that not be an absolute disaster. And I told this to his face. I was like, I love your passion and I love that you believe we can fix it, because you can't fix things you don't believe you can fix. But I am telling you, you cannot mix certain populations. Some people will be successful in that type of an approach. Some people that is definitely not going to work for. You have to understand. And also, if you do not then have steps 2, 3, 4, 5, 6, they will just fill up. They will become problematic and they will not work. And so, that is my critique of the office, which, I'm not sure if that was what you're looking for, but I just fundamentally don't think it's got the vision and leadership and accountability. And I am not sure it can, because I don't know if the city and the county share a vision. I mean, I got to be honest. If Renee Gonzalez wins, I will not share a vision with Renee Gonzalez. We do not have the same idea of how you approach these things. I don't know if a joint office, I'm not the chair, so that's not up to me, but I have really strong feelings about criminalizing status. I don't believe in criminalizing disability, and that is not an approach I would endorse.
Thanks for your response, Megan. I'm noticing we have another question in the chat from Brenda. Do you think the new homelessness response action plan, the HRAP, is a viable plan? And does it address the gaps that you've spoken to?
No, I don't think it is. And no, I don't think it is. Not to the level of detail that I believe necessary. And I'm not saying that needed to be in an executive summary, although I looked at all, I think it was 48 pages. I can't remember exactly. One, I thought it was a lot of rehashed ideas, that I have real questions about what progress we have made, what would be different this go around if we're continuing with those strategies that would make them more effective. But I did not feel like it dug deep enough into subgroups with measurable, accountable metrics for success. And I don't think it ever addressed some of the issues I see with jurisdiction that that would have made it. Part of me feels like you have to assign ownership of certain services, but then give whoever it is that runs that. And this is part of the issue of like, is it the Office of Homelessness? Is it somebody with the county? Is it somebody with the city? Who's accountable for that? Who owns that outcome? And are they actually empowered to do it? I do worry about that sometimes. One of the things I believe is hire the right people and let them do their job. And then have real transparency with how it's going. And I sometimes too many cooks in the kitchen leaves nobody as the executive chef, and a lot of people being like, well, I don't have the power to do that. We need to be breaking things up, and there needs to be people with enough authority to make the needed progress. One of the things that disheartens me, and I actually have a kind of a pretty strong reaction to it, is there's a group of people, I don't know, I don't track where different thought ideas come from always, but who have this idea that like nonprofit professionals are somehow part of the nonprofit industrial complex, and therefore don't know what they're doing, don't want to fix problems, and are happy with the status quo, which I find profoundly offensive as somebody who's spent most of my career working in the nonprofit sector. It is that group. I find that so ludicrous. I mean, I don't look at, sometimes I do, business leaders think that they know how to fix problems they know nothing about. And if that were true and they're such geniuses, then why is 30% of our commercial real estate in Portland vacant if they're such brilliant geniuses? Things happen in economies. I do fundamentally believe the overriding cause of homelessness is a lack of affordable housing. That's economics. There are subgroups that have very real barriers to being housed that need supports that do not exist. That is my view. And I believe that there are people who have spent their careers working with these communities, who understand people's lived experience or have their own lived experience, that makes them the most appropriate, most qualified individuals to guide service delivery. And I am not that person. I am the person who figures out how do we set up a structure using and maximizing funding streams so that it is a coherent system, so that people can live the most independent, successful lives they can. And I have a very real understanding of what that is. I don't think, I talk about this, not everyone who experiences serious substance use addiction or mental illness or both at their most stable will be self-sufficient. So get real about that, everyone. We don't do that. We fundamentally do not have a system that acknowledges that some people, even at their most stable, need long-term, forever supports. I know it to be true. I believe in it. It is way more compassionate and cost-effective to provide that for them and not do what we do today, which is pull the rug out from people so that they cycle through crisis over and over and over again. It is totally ineffective. It is incredibly expensive, and it is not a compassionate thing. So I don't have misconceptions like, oh, everybody just needs 30-day inpatient and we'll be fine. Like, also, I'm very real about we don't have an appropriate addiction treatment system. When I say what I believe a realistic timeline needs to be with our current system is we need to have at least a 2-year commitment to people who enter treatment. Now, that's not all like inpatient, or it's everything. And for some people, it's longer than 2 years, but like be real about what we're experiencing. And I think that that's also missing is having a hard conversation that we don't have the treatment system that today's situation calls for.
You again. We have 2 questions. Let's hear from Stephen. I think you put your hand up first, and then Deanna. Deanna.
Yeah, I'm Stephen Gilbert. I recently joined Transition Projects and entered into the housing services sector. But the first 20 years of my career, I was a program manager for mental health programs that specialized in serving both people with co-occurring disorders of mental illness and drug or alcohol dependency. I want to commend you for being the only political leader who I've heard address this issue in such an accurate way. The missing link in homeless services is many of our participants who have severe mental illness or history of addiction, they need intensive inpatient, medically assisted care for several months, not several days. The proposed sobering system at Providence is an expensive joke. 8 days is not a long enough time to get people anywhere close to being stabilized. I know what the barriers are. The insurance industry doesn't want to fund a long-term inpatient, and government sees inpatient as being too expensive. So I think we're a long ways away from having that available. Meanwhile, shelter providers are treading water, trying to keep their head above water to handle this population. And I'm trying to think of as an interim between now and whenever that ideal mix of services arrives. We need more highly trained line staff in shelters being able to work with these participants. And we need a closer partnership with county mental health and addiction treatment to provide, some additional wraparound care. Perhaps also more group homes for people who, once they're in that recovery phase from their illness. So as a new county commissioner, looking at us shelter providers out here treading water, trying to keep everyone afloat, how could you perhaps fill in some of these gaps of support that we need in working with this difficult population?
Well, I want to start by stabilizing what exists in our capacity.
Mm-hmm.
One of those things is we have to move to 3 to 5 year contracts. We need people to be able to hire staff and make at least some level of reasonable commitment to their employment. And I think that's problematic, and I know some people are going to be a little unclear about that, but I have seen too much. Let's jump from shiny object to shiny object and not actually follow through on one of the things that I do support. Other people may not. We had something earlier in the pandemic called Project Turnkey, that provided individuals with, sometimes it was a motel that was for sale, but it was largely single room occupancy with bathroom environments that would have wraparound services. It was somewhat new for Multnomah County to invest like that, but it was actually successful. Was it perfect? No, of course there was growing pains, but it was actually successful. After a year, they abandoned it. That was, to me, ridiculous. I actually do support a model of single room occupancy with attached bathroom with wraparound services as one of the settings that I think is really missing, particularly for people who need a transition, post, secure camping, post shelter, maybe begin, maybe outpatient, there's this level of housing I think is not being invested in to the degree it needs to be. And with some level of variability, we're going to have people who are not fully abstinent from substance use, but are ready to not be in a congregate environment. That's going to need to be separate from people who are engaged in an abstinence program, to be supportive. And I don't want to bring judgment to that, but I want it to exist. But I really agree with what you're bringing up around, like, how we are not going to turn a switch and have a system. That's not, it is, what I'm proposing will have to get built out. But the way I envision it, and some of it'll be a little clunky until we can fill in, but there are some moments in which we are engaging with people where we're not taking advantage of those relationships we're building. One is we have, a non-police crisis. Well, one is non-police. We have Portland Street Response. Then we have I'm going to be honest, I don't really support police and mental health as an approach I think it criminalizes mental illness. I'm just going to be honest. I've also seen a lot of research about this. So I do support the CAHOOTS model from Lane County being the model. But again, I think we're limiting its usefulness by only viewing it as how do we de-escalate so we don't need police. If we funded it appropriately, and I've also thrown out, and people may or may not love this, I want the county to take that over. I want it to be countywide. I want to use the CAHOOTS model. I want to put it under a federally qualified health center so that we can get federal match. And I want to quadruple the size of it because I want it to be 24/7, and I want people to stay in geographic areas so that they are building relationships, so that they are able to engage with people to a point where, and this is where the services that don't exist need to come in. How do we get somebody voluntarily to that better next step for them? And that's going to look different for different people, but I think we have to, it's not like the senior and disabled services of Multnomah County that largely really require people to come to you meet with a case manager, you have your evaluation. We have to rethink how we do this, but we have to, because of Medicaid, You still have to have those functions happen. You still have to assess somebody. You still have to enroll them. You have to do an eligibility determination. But we have to think totally differently about how that's done in a way, because if we did that, there could be a appropriate funding stream that follows that person to wherever that next step is. And it goes with them, depending on what their need is. For us to have a funding stream that would ensure that you could transition somebody from one thing to the next and they didn't have to go through a whole new rigmarole, like that's a game changer. And if we're talking about people who are going to need more than at 6 months of care with housing, the idea that there would actually be funds there, you know, I don't blame the health authority. Well, I do for a lot of things, but I don't, you know, they asked for longer to get housing paid for under Oregon Health Plan. They were only given authority to do 6 months. This should have, or Arizona got a year. I wish we would have gotten 2. I mean, but 6 months is not going to get us where we need to get with a lot of people. And so for me, it's like, I will push the envelope. Or I fought and got Oregon to be the first state to adopt community, what's called the K plan for long-term care. I literally helped get that. And then I helped write it. I believe Oregon can be the first to do things and do them well. I'm gonna tell you, if you know anything about DD services, it was an absolute game changer for DD services. We went from thousands of people on wait lists to no more wait lists and an entitlement. So, you know, I want to bring a system where funding isn't such a scarcity, that if people are eligible, the funding follows the people. And that really changes what providers can view as their capacity. If you know that a person's coming with a funding stream based on their need, it's totally a different way of approaching what services you're going to bring into your organization. And I you know, and this is why these nerdy, very policy things matter.
Mm-hmm. Thanks, Megan. Let's make time for one last question, and then we'll have a couple minutes to close.
Hi, thank you. My name is Dina, and I am a longtime employee at Impact Northwest. I'm a housing advocate and have been in the housing and safety net services for my duration of my employment at Impact. And so I definitely come with a lot of experience and knowledge about what I've seen those that are unhoused experience. And I'm a community-based social worker and field instructor for the School of Social Work at PSU, among other universities. And so I'm very community-based, and I'm also somebody that values in the meantime strategies and resources. And you've been talking about long, big pictures about what we need in the long term. But something that I find is lacking in a gap of service and need that I feel is really important. And so based off of like what HRAP put forth, that thousands are doubled up, can't access shelter because we are at maximum for shelter. In addition to that, we have the amended camping ban. In addition to that, we have those that have disabilities and are isolated and can't work. We have seniors who are isolated. We have youth. And that in conjunction with, and you'll get what I'm throwing down in just a moment, that with remodelings of various libraries in communities that aren't Hollywood, aren't areas of more affluence. Something that I see that is lacking is our development and importance on third places. If we're going to have camping bans, if we're going to have a lack of shelter, people need to exist. People need to hopefully exist in third places that are free and don't require a membership to obtain. If people can't access first and second places, home and work, where are people allowed to exist in Multnomah County? And this is a very important, in the meantime, resource for housing advocates, for people who are not able to access shelter, for people living in their cars. I don't have to explain more on the necessity. Community solves a lot of issues that we have in our society, and people are increasingly not allowed to congregate in spaces unless they have a purpose or they have money to access the place. So my question to you is, how in this position would you elevate, lift, and amplify the need for third places while we move forward with long-time strategic plans to get people into permanent housing?
Yeah. That was like so well said. I really appreciate that. And the organization I work for gets involved legally with a lot of these issues because I think we are trying to criminalize somebody's existence. But there is a need and an unmet need. And I am there are not one answer. So I'll be honest that there's not one answer. There are a few things that I really like that I want to see replicated. One is there's a program in Deschutes County in Bend that it's a 23-hour crisis stabilization center is what it calls itself. Because that's technically like the licensure it falls under. But the model I really like about it is this place for people to go who it's with, it is not a pathway to involuntary treatment. It is a place where people can take a shower, can clean their clothes, can charge their phone, can hang out and sleep if they want to, connect with social services if they want to, have snacks and food. And it is a place where police officers will drop people off in lieu of an ER or jail. And it has been incredibly successful for people. It is a calm space. It is a space that is, I think it's viewed as its like goal. How do we take people who are in crisis and de-escalate them? And yes, it does that, but it does a lot more. What we're seeing is it's a place that now people trust and will voluntarily walk into. They are, they may start out wanting a shower and end up spending more time and connecting. One of the things that I think has to start to happen is there needs to be places that people can go to that are not going to lead to arrest or involuntary hospitalization. And that, some people are going to have feelings about that. And that doesn't, I'm not saying that they're going to turn into unsafe places, but voluntary engagement is largely non-existent here. Like, I think people don't get that. Everyone wants to talk about all these involuntary things. And I keep saying, have you offered anything voluntary? Because you can't say somebody wouldn't accept help. There's a huge difference between somebody choosing their own path to recovery and saying yes to the path you want to make them take. Those are not the same things.
Thank you.
And I
sorry to interrupt, Meghan. I'm just realizing I just have a couple minutes left. And so I want to just offer you like one more minute to finish that thought or say any like final words before we close.
Thank you. This is very much, I feel at home in this group. So thank you. It's very hard to have these conversations with people who want a 30-second soundbite of how we're going to fix these things. This is a very different audience, which frankly, I really enjoy. But I hope, if you got anything out of our conversation, it is that I want to engage with you guys on a really deep level. Like, this is hard work. I am not signing up to be an elected official who goes to all the events. That is not who I am. I am running to be able to have, hopefully, the ability to fix a problem that I am passionate about. But this is a group of people who will need to be at the table. And that is why I'm running. And if I win, I am going to take up some of your time and want to have really hard, complicated conversations of how do we do this. But I know we can, and I trust you guys to be able to do it. I want to help you do what you do better.
Thank you, Megan. Thank you for being in community with us today. Thanks everyone else who is here. Thanks for joining. Thanks for great, very real questions. It's nice to come together and be able to talk about these ideas. We will make sure the recording of this is available for you to share or pass on. If you're interested in working with Impact Northwest to help coordinate more events like this, reach out to Ada. She will drop her email in the chat. And anything else I'm missing, Ada? If not, I just want to thank you all, and I hope you have a great rest of your day and week. Thanks again, Megan.
Thank you so much. Appreciate it.